How has the vaccine uptake been in Tobago? How have the COVID-19 cases been in Tobago? Let's find out this morning. Tracy Davidson-Celestine is on the line with us, the THA Secretary of Health, Wellness and Family Development. Good morning to you.
Good morning to you and good morning to all of Trinidad and Tobago.
All right, so how have let's start with how have the vaccinations been going? I know we've been trying to get people in Tobago vaccinated. We had a slow start. Have we seen an increase since we have more variety now?
Well, people are coming out to be vaccinated, not in the kind of numbers that we would expect, but they are coming out slow but steady. In terms of our targets, we are hoping to vaccinate at least 70% of the Tobago population, and the Tobago population being those who are eligible for the vaccines. And so we are talking about adults, persons from 18 right up to senior ages, and then we're talking about school-age children from 12 to 18. The Tobago adult population is in the vicinity of about 45,000, and we have about 6,000 additional being students from age 12 to 18. And if we are attempting to vaccinate 70% of that, we're really talking about a 36,000% target population. As it is now, based on the information from primary care received yesterday, we have vaccinated approximately 19,307 persons so far with the first dose, and a further 4,799 persons with a second dose. Based on the targeted population, we are about 54% of that population with first dose, and just about 41% of that population with second dose, and that would include both the adult population and the children, the student-aged population, which is from 12 to 18. So while it is slower than we expected, we are still pacing very well at 54% in terms of first doses, and further, and 41% of that in terms of second doses.
All right. Well, I think that means that we're moving at a decent pace. Are there any plans to be able to increase the numbers of people coming out? How do we reach more people? How do we get more people to the other 16,000 plus adults that we need to still take this vaccine to get to the target? How do we improve the campaign to get to them?
Well, yes, you're right. We have about a further 16,000 to 17,000 persons to be vaccinated. And our approach is one that would look at a community effort, one where we would see the teams setting up tents and camps in the electoral districts, and of course within villages of those electoral districts. That campaign started last Friday, where they went into Scarborough. They were set up at the Port Mall, and they were able to vaccinate over 180 persons in that one sitting. And so the schedule will be publicized in the not so distant future, where they would be going next to, I think it's the north side, targeting some of the rural communities like Lansome, Palatavere, Castara, and then moving into other areas like Charlottesville, Delaford, Roxborough, in a greater way. And so the campaign is on. We have had some public education exercises, roundtable discussions with doctors, members of the different sectors, of course, urging persons to be vaccinated. And now we're taking a grassroots kind of approach, where the intent is to knock on persons' doors and be in a position to answer any questions so that we can allay their fears. Because, of course, you know, it is very important to have as many persons as is possible vaccinated, so that we can treat with any health challenges or minimize any significant health challenges going forward.
Mr. Davidson-Celestine, good morning to you. I was just wondering, because Tobago has also basically been said that, you know, there are a variety of vaccines there. Can you let us know what vaccines are available to Tobagonians?
Well, all of the vaccines that are available nationally and internationally are basically available in Tobago as well. And so you have a combination of first dose, one dose vaccines rather, which would be the Johnson & Johnson. And then there are the 2 doses, which would be Pfizer, Sinopharm, and then AstraZeneca. So whatever the preferences are, there are those options available to the people of Tobago as well. And when you look at all of the offerings, we compare very favorable to those well-developed countries of the world, whether it be the United Kingdom or even the United States of America. And that is something that is a significant achievement for a small country like ours.
Definitely. Mrs. Davidson-Celestine, what are some of the concerns people are still drawing when it comes to why they haven't taken the vaccine as yet? And when you do the public outreach, when you go around to people, what are some of the common things that we're still hearing?
Well, there are still some fears in terms of persons have indicated that, it's the mark of the beast. Some have fears in terms of infertility, affecting libido in a number of different ways. Some are afraid of deaths. And, one of the things that is also coming out, for every person who is fully vaccinated and who dies as a result of many different situations, comorbidities, etc., persons equate that to meaning that even though you have the vaccines, there is really no chance of preventing deaths. And so some people convert that to mean it really makes no sense at the end of the day to take the vaccines. But what we are recognizing, it's not that the vaccine kills people. It may be that the persons have other existing health conditions that would have caused them to die even though they were fully vaccinated. So, sometimes it is reported that XY died with COVID but was fully vaccinated. But it might have been that that person would have died from some pre-existing situation, perhaps something having to do with heart failure or kidney, as opposed to dying from COVID and being fully vaccinated. So it's sometimes how we communicate information. Sometimes it's how the information is communicated even by the members of the media in terms of those who are vaccinated and who pass on as a consequence.
We also see, though, I'm curious as to if the increase in the numbers of the COVID-19 cases, you think they would affect people's desire to take the vaccine? Because, yes, we're talking, you spoke about people dying even though they've been vaccinated, but we do know that the vaccines tend to curb the spread. It may not completely stop it, but it definitely makes it, spread less, for lack of a better word. So do you think that the increase in the COVID-19 cases would motivate people to say, all right, maybe I should, just so that we can stop the spread?
Well, we are hoping that a number of things would be the catalyst for persons coming forward to take in the vaccines. One would be the increase in the number of positive cases on the island. And of course, the research would indicate that whenever there is an increase, there is a very high possibility of persons needing ICU care and those very high dependency services, and we're seeing evidence of that in the population. We're hoping that when we put out information on that in terms of the press conferences and even answering questions, that would also be a catalyst. We're hoping that what is happening worldwide, what is happening internationally, and even in the Caribbean, in our brothers and sister countries out there, that also would be a catalyst to persons coming forward, and also presenting information to members of the public so that they can be informed in terms of the consequences of not taking the vaccines, all of those, and utilizing live or real situations in Tobago as well. So even in our public education exercises, we have had persons come on set who would have contracted the COVID and who survived and who used that experience to share with members of the public. And so there are a combination of things that we are doing with the hope, the intent of getting as many persons on the island vaccinated as is possible.
All right. I want to wish you all the best with that. I know we have some challenges that are going to come up soon. Maybe we don't even know exactly when yet, but I know that there's to be elections in the air across in Tobago. Do you have a concern about spread when it comes to campaigning and stuff like that?
Well, once as people are moving around and moving around in large numbers without following the basic rules and regulations, and especially if they are not sufficiently vaccinated, there will be challenges. And so, one of the things that we are seeing in terms of the increase in positive cases is that people really want to move around. But at the end of the day, we have to try to manage, that kind of freedom and independence that people want. And so with regards to the election, if people are moving around, there will definitely be some challenges going forward.
With respect to moving around, there's the likelihood that it will increase with the elections coming up. But what's moving around like now in Tobago? Are Tobagonians basically adhering to the safety protocols right now?
Well, the thing is, we have been seeing some increases over the last 2 months or so in terms of positive cases on the island. And so that tells us a number of different things, that there is movement in large part, in large measure. It also tells me that people are not following the basic rules and regulations in terms of physical distancing, wearing masks, and even washing hands. And it could also point to the picture that people are becoming more accepting of COVID, and they are, preparing to live with COVID on the island. And so the numbers are increasing, and it tells us that, yes, there is some movement in Tobago. And as I indicated, perhaps people are now more accepting of COVID and would want to move on. But, in all of that, there would be a challenge for policymakers, there would be a challenge for health workers, because movement and not being fully vaccinated would present a significant challenge to the health system in terms of making it very overwhelmed, and that is what we are trying to prevent. And of course, if it becomes very overwhelming, there would be significant challenges in terms of ensuring that all receive the kind of care that we would want to give to them to prevent any significant health consequences.
But aside from the actual health care, I assume it would also affect business operations and the ability to earn. So I don't know how we can get that message across any clearer than that. Yeah. If what we've been through so far hasn't shown you that, all right, guys, if we don't at the very least adhere to the public health ordinance measures, if we don't at least do that, then we're going to end up in a situation similar to what we've been in for the last year and 3/4 at this point.
1 year and 6 months.
Exactly.
About. And it has been very rough for all of us, even for the tourism and the business sector in Tobago. And you would hear them clamoring, you would hear them advocating, giving support in some instances to the government and its vaccination program. And it's because, whoever is in the kitchen would feel the heat. And in large part, we have not been able to have international direct flights to Tobago as a result of the COVID pandemic. And it becomes very frustrating and overwhelming for them whose livelihood depend on the reopening of the sector.
Exactly. Well, I hope that we can get that message across, and that you continue to spread the message and people take that message and do what they need to do to get vaccinated and to also adhere to the health protocols. I want to thank you so much for joining us this morning, Tracy Davidson-Celestine, and for sharing with us what's going on in Tobago.
Thank you very much for having me.
Do enjoy the rest of your Thursday. Take care. That's Tracy Davidson-Celestine, the THA Secretary of Health, Wellness and Family Development, just giving us a brief update on what's going on in Tobago. Still a bit slow on the vaccine uptake, but there's some light.
Yeah, because, when you think about, and then the air bridge has opened up some more as well between Trinidad and Tobago, and we love Tobago. We love to go there. You have to think about your safety and the safety of your family.
Yeah, but it's more than just us, because like you say, the tourism sector, we've been trying that domestic tourism. But if everybody out of work, right? If everybody not working, then nobody have vacation money.
That's the thing.
So we need to realize that tourism is not just us, the domestic tourism, but there's also the international tourism that has not been coming in as a result of the pandemic, as a result of the closed borders. And now that they open, it's still a process, and we still have cases, and people are like, safety.
Yeah.
So
I don't know what else needs to be done because it's a global problem where vaccination is concerned. And
it's also a global problem where misinformation is concerned.
Oh my goodness.
So we have plenty global problems.
Lots of that. I mean, up to yesterday, I was looking at a video. But, you know, I was looking at the U.S. as well, and I think they said 75%, I think, I didn't hear probably if it was just the first dose or both doses of the population now in the U.S. have been vaccinated. But it took them so long to do that, and still so many people are hesitant, as they are here as well, because of the misinformation. And I don't know if maybe, you know, if it has to hit home before you really realize how serious this thing is. And by then it's like, it's too late.
It's one of the hardest lessons I think you would ever learn, if that is the case.
You know, I lost someone, a really dear friend took COVID. And then someone else was much younger as well, took COVID, you know, a friend of a friend. And I saw her just before she died. And it's not easy having to go to funerals of your very close relatives and see it virtually, and you can't do certain funeral rituals because you can't.
I mean, we can't for any reason that people are passing away now, and we need to realize that this pandemic is real, and you have to do your part, I have to do my part. We all have a part to do. Let's take a break and we come back and we continue doing our part right here in the Now Morning Show. Stay tuned.